The aim of a fusion surgery is to immobilize 2 segments or more of your spine. If you have abnormal motion or abnormal movement of the spine, that can be a source of pain. So when we go in surgically and release pressure off a nerve, we also have to correct that mechanical instability. Eventually, your own bone grows into the bone graft that we put in during the fusion surgery, and that segment stops moving.
Out of the blue, I began developing pain going down the outside of my right thigh that would go into my leg, and I couldn't drive to my work site. I couldn't walk my dog, couldn't ice skate. I made the decision to have the surgery, and I've never regretted it for one single moment.
Before surgery, I think being on a calcium and vitamin D supplement is important to improve fusion rates. Smoking delays and can even hinder bone healing, which makes the failure rate extremely high. Typically, for spinal fusion, you'll come in the day of surgery, and it is an operation that we do under general anesthesia. Most patients, they stay in the hospital for 2 to 4 nights. Typically after the 2nd to 3rd night, most patients, they feel much better. I want my patients to get up and move. And the faster they get up and move, the faster they can be on their way home into recovery. For the first 2 weeks after surgery, I typically say no driving, and we say no BLT, so no bending, lifting, or twisting. I like to let my patients know that a lot of these restrictions are not because you're not gonna be able to do these activities. It's more to restrain you so that you do not injure yourself in the immediate aftermath of the surgery. Kim did really well after her surgery. She progressed very nicely, and now she's, as far as I know, she's back to hiking only a few short months after her surgery, so that's pretty good.
I was 2 days out of the hospital, and I walked 1.5 miles with my Great Dane. I hadn't done that in months. I was able to hold my brand new baby grandson in my arms. It felt so good to be normal. And Dr. Asfahani gave me back my life and hope that there are physicians out there who really care about me as a person.